Super. So now just moving forward from introductions, I just want to give a disclosure. The University of Utah Transgender Health Program will not be advocating for any specific insurance plans. This session is intended to provide broad information around how to be your own advocate, or in y'all's cases, advocates for others, and what to expect from insurance and the process. And some of you might be wondering, why is it important to be your own advocate? And that can be answered in a short statement. It's to gain a sense of control. So the more information we have, the better able we are to advocate for ourselves and others. So I just want to make this brief, but when it comes to transgender health, we have had hundreds of years of intersex bodies at the whim of experimental genital procedures, resulting in sterilization. And recognizing the past can help inform the future. And this is what has informed the binary model of male and female and concepts of gender, due largely to colonialism, though bodies with intersex conditions were honored as sacred through many cultures. To not confuse intersex and transgender bodies, though, intersex folks have reproductive anatomy or genes that don't fit typical definitions of male or female, which is often discovered at birth, whereas being transgender has to do with your internal knowledge of your gender identity. Today, folks with intersex conditions can have corrective surgeries. This is covered 100% by insurance, as long as they have genetic testing to suggest that they have intersex condition. So I think it's important just to kind of talk about how our medical industry is informed by the bodies that were utilized in how now we know how to do phalloplasty and vaginoplasty because of other folks' bodies. Transgender folks, through their internal knowledge of their gender identity, have a bit more hoops to jump through when it comes to accessing care, getting procedures covered by insurance, and that's what we're going to touch on throughout the presentation. Just to briefly talk about our program, the Transgender Health Program has formally been around for about 2.5 years. However, each separate discipline has been providing transgender care for the past 4 years. And there are currently 3 paid positions through the Transgender Health Program. We have our patient coordinator, our program coordinator, Ariel Milan, who has a master's in healthcare administration through the U of U School of Business. Jesse Flouch, he, him, coordinator, patient coordinator as well as myself. And we're proud to relay that everybody in our team is queer, and both of our trans patient coordinators are trans. Our program director is Corey Agarwal, who is who's a plastic surgeon. She is familiar with vaginoplasty, vulvoplasty, and chest masculization surgeries. Where this is not a picture of us at all, but these are the folks on the surgery team. The types of gender affirming care that we provide as a whole are gender affirming hormone therapy through the primary care and endocrinology, adolescent medicine through our GEMS clinic. We have an OBGYN, hysterectomy, oophorectomy, fertility, sperm, cryopreservation or egg preservation, plastic surgery related care, including chest masculization, breast augmentation, facial feminization, body contouring, pelvic floor therapy, speech therapy, laser hair reduction, urology related care, including orchiectomies, and then combined plastic surgery and urology cases, which are vaginoplasty, vulvoplasty, phalloplasty, metoidioplasty. And we refer our community to our community for mental health letters, which I'll be going over in a little bit, to submit to insurances. And our list is one that folks can reach out to our transgender health email at to get our list. It's vetted, and we are still in the process of continuing to make it the best list it can be. I don't know if this, oh yeah, beautiful, cool. So recognizing transgender health is an important part of humanity that has only been within discussion for the past couple of years as a whole. We have social wellness, the ability to connect and relate with those in our world, our ability to maintain and establish relationships with others, family, friends, coworkers, etc. Emotional wellness, the ability to understand ourselves and cope with the challenges that life can bring, the ability to acknowledge and share our feelings of happiness, sadness, anger, fear, stress, love, and joy in a productive manner. We have spiritual wellness, the ability to establish peace and harmony in our lives through recognizing one's life purpose. And this doesn't have to be religious, it can be a personal matter. We have environmental wellness, our own ability to recognize the earth around us or our living space and our own responsibility to making a positive impact on the quality of the environment we live in. We have occupational wellness, the ability to get personal fulfillment from our job or chosen career fields while still maintaining balance in our lives. Intellectual wellness, our ability to open our minds to new ideas and experiences that can be applied to person, decision, group interactions, community betterment, our desire to learn new concepts, improve skills, and seek challenges in the pursuit of learning. Physical wellness, the ability to maintain a healthy quality of life that allows us to get through our daily activities without undue fatigue or physical stress. This is also our ability to understand that our behaviors can significantly impact our physical health. And when it comes down to discussing health in general, we're learning that it's not just about how you're physically feeling. Now more than ever, we're having to shift our view on health to talk about us as a whole person and not just as a diagnosis. And how we talk about health, how we view it, and our investment in our overall wellness determines how we approach healthcare. These dimensions of wellness are heavily linked to the world of capitalism that we live and operate under. Transgender folks often are missing a few of the facets of wellness, which you know, it can relate to being multiply minoritized. And it's our job to assist in finding them access to care and disseminate this information. Let's see. So I just wanted to briefly bring up that under the Affordable Care Act, it's illegal to any provider that receives federal funding to discriminate against you because you're trans. So that can look like a myriad of ways, discrimination. And the Affordable Care Act also, known as Obamacare, prohibits most health insurers from discriminating based on gender identity and transgender status. However, like insurance can make it so that there are multiple hoops to jump through, or if your legal ID, your driver's license is different than your insurance. There's a myriad of ways this can look. And that kind of gets into later like billing issues. We can almost always expect trans patients to have billing issues. And this is because largely due to the fact that we're paving our own way in a system that wasn't meant for us and in a system that wasn't built for us. So talk about a little later about what to expect and then how to be your own advocate when it comes to, hey, this bill doesn't look right. How can, we have a team that is dedicated to appealing so many of the issues that might arise. So we can get into that later. And here we just have some court rulings. I know that this was like, almost a year ago, but it's just good to recognize the progress and where we've been and where we have yet to go. So I'll dive in a little bit deeper into what is required for top surgery specifically. So WPATH, the World Professional Association for Transgender Health, requires one letter from a mental health provider, has to have at least a master's in mental health. While I understand there are many other insurances that actually make folks jump through more hoops. So we'll have not only one letter, but they'll additionally have folks have to have a second letter or be on hormone therapy or 12 months living within their congruent gender identity. So these are things that the bottom two are a little bit more flexible with non-binary folks or folks who don't plan to ever go on hormones. And that has to be discussed within the letter from a mental health care provider, why that's not their gender journey. But it does have to bring up the documented gender dysphoria and the diagnosis code of F64.0. This is super important in getting insurances to cover procedures.
Hey, Catherine.
And hey, yeah.
So what does WPATH mean?
So WPATH is the World Professional Association for Transgender Health. It is, it's like the standards of care that a whole multitude of professionals within the transgender realm, doctors, have decided should be the standards of care of like baseline. This is what everybody should have to go through in order to access services. So
Okay.
Great question, yeah.
So, and just to clarify, so that means like this is the baseline, but that, like you mentioned, this doesn't necessarily mean that this is the baseline that all of the providers or plans would set. There could be something more strenuous or exhaustive that would be required.
Right, totally. So there are many plans that make folks jump through additional hoops. So like, yes, you can't discriminate, but there are different modalities that we have that make it so that our minoritized groups of folks don't have access to care if they can't, get a second letter or don't have, the capacity to be on hormone therapy and whatnot. So yeah, this is the baseline. If the insurances have transgender benefits. And I'll get into a little bit later what it looks like, what transgender benefits, how to find those. But this is baseline. And same for bottom surgery, so including vaginoplasty, vulvoplasty, phalloplasty, and metoidioplasty. They have to have two letters from two different mental health care providers. And there are some insurances that require one of those letters to be written by somebody who has a PhD. All of the letters have to be written by folks with at least a master's degree in mental health. But again, that's another hoop to jump through in that doctors are a lot, psychologists are a lot more expensive to get the diagnosis instead of from a mental health care provider. So it's another hoop to jump through. But this is baseline is two letters from at least a master's degree in mental health. Again, it has to talk about gender dysphoria because this is the code that we bill under. And then again, the capacity to give consent. And then there's a little bit more flexibility with hormone therapy here. And I think that's always important to talk about because there are a plethora of folks that seek services that don't identify within the binary and just want to live their authentic life outside of gender structures. So that doesn't necessarily have to be everybody's, it's not a transition, you know, it's we're talking about, we're not going from point A to point B. It's really like a journey. It's and each one is unique and different. So, okay, and then let's see. So I know that we already have passed, yesterday was the deadline for the special enrollment of insurance. But this is somewhere I think it's important to talk about that about, you know, 3% of marketplace insurance discriminates against trans folks. So they'll have an active policy that says that they do not treat trans people in general, and that's really low. However, if you get insurance through your employer, they're not legally bound to have transgender benefits at all. And that's something that is really important to talk about because a lot of folks don't have the opportunity to opt in or opt out of their employer's insurance. And these plans can look really, really different and specific outside of the realm that there are so many plans in general. But it's always really good to check with HR if that's something, you know, that somebody wouldn't be outed by doing, to check what their plan looks like and whatnot. So yeah, it's a little bit more tricky with employer type plans, and we've come across a lot of issues internally with folks seeking gender affirming care and having an out-of-pocket maximum that was not ever discussed, and it was only specific to transgender related care. So that we're understanding that as we're really like kind of paving the way to the entire idea of being able to access gender affirming care, there's so many more questions than we have answers to. And this is something that we can collaborate on a larger scale, is understanding from a layer and then collaborating on another layer of, okay, so I think it's really important to be able to bring up if there are any specific transgender exclusions. So I don't want to jump ahead because I get too excited about benefits rather than exclusions. So I'm just going to talk briefly about Medicare and Medicaid. Both Medicaid is state-by-state plan for low income, low loss coverage, or meeting other certain criteria depending on different states. Utah's Medicaid covers hormones 100% and covers top surgery 100%. Prior authorization process, which I talked a little bit about before with the letters. Those are what is needed in order to submit to insurance to say like this coverage is medically necessary for this person to have a gender affirming surgery. And then Medicare is for 65 plus, or if somebody has a disability status. This type of coverage, they don't do any prior authorizations. So we just make sure that folks have their 2 letters, the base 2 letters, and have had a consultation with one of our gender affirming providers on their service that they're interested in receiving, And that's something that we submit after the procedure has already been done. And then we have folks send or sign an ABN form. And now I forgot what ABN stands for. Oh, I'll get back to that. There's many plans that do not cover facial feminization as a benefit. However, so many of these plans, because they're really new, I very much advocate, if this is at all within the realm of possibility. I know that not many folks have the privilege to do so, but in opening up an appeal, so once we submit something and we get an answer back, submitting an appeal is one way that, you know, we can change the minds or change the policies surrounding insurances. Once they see more of these appeals come through, then that's one way that, for instance, chest masculinization surgery is something that is now covered by so many insurances, is because we've had to appeal so many, and it becomes the norm of like, okay, so there's a need. We, you know, should probably start covering this in a way that doesn't utilize, you know, resources to appeal in many ways. So all of these in the authorization process will result in something that's called a medical like necessity. So the authorization process for bottom surgery, like I said in the previous slide, is the 2 WPATH letters. WPATH standards of care is something that you can Google, and then you can even Google like vaginoplasty and see exactly what it takes for folks to undergo surgery and what the hoops they have to jump through at a standard level. And then I'm not sure how much y'all deal with in and out of network coverages, so I can skip that portion. Just, we have a lot of folks that come to our program, about 12% who are from out of state. And so Idaho Medicaid will look super different, and we might have to you know, gather like something called a single case agreement, which just means, yes, they're out of network, but we need an in-network amount for this procedure, since we're the only one in the Intermountain West that can perform this surgery. So there's, we're the internal advocates, Jesse and myself, in helping folks access, you know, do the prior authorization. But I think it's important to kind of understand a little bit more about what goes into it in the appeals matter. And let's see. And I already assumed that Sarah, maybe nod or something that y'all know what deductibles are. And so, and out-of-pocket maximum. So I don't want to get into something that y'all already know. And that I'm sure y'all are already a huge advocate for disseminating that knowledge amongst folks, in that it's really difficult to sort through and understand, because it's a whole nother insurance jargon. So I just wanted to move past there. Let's see. All right, so the cost of care, we had talked about a little bit when it comes to, and there's a really great list of grants at the end of this presentation that I can also send your way. So there's many options that we offer. The self-pay option, we offer this for top surgery, and actually all of our surgeries. We require that folks have a consultation, since facial feminization can look different for everybody. it can range anywhere from like $5,000 to $50,000. So it's not something that we could give you right off the bat, but self-pay is something that anyone can inquire about. We usually, the direction that we send folks is to perhaps look for a credit union, like through a credit union, getting a personal loan. If not that, then the grants that'll be at the end of this discussion, fundraising like a GoFundMe. While we don't offer right now a financing option, it's $200 to schedule a surgery date. And then the remainder of the cost of like top surgery, for instance, would be due a month before surgery. And I understand that this isn't necessarily something that is accessible to everybody. So that it's there as an option. If last case, if insurance doesn't pay, but we're here to talk about what insurance can pay for. All right, so in finding a gender affirming provider, nowadays you can find pretty much anything on the internet. The resources of finding a gender affirming provider have only increased. And honestly, the internet is the best first stop to anybody that you're looking for. I know that our specific transgender health page has, which I'll give y'all the presentation, but you can go to our website and you can even find a trans-friendly dentist. I recommend like going through some of our providers and first looking for the names of the providers and then calling insurance and saying like, hey, is this person in my network? Is this person in my network? And that's the best way to really be prepared in having that conversation, because our providers won't be able to tell you if they're in network with a particular insurance. So I know anecdotally, when I was on Medicaid, I was like, I have no idea where to start. Where, how am I going to find like a trans-friendly doctor? And where I started was on the website and finding like, okay, so there are a handful of university doctors who accept Medicaid, and I called and like asked, okay, so what about this this doctor? And they utilize informed consent, so jumping through the hoops of getting hormone treatment was not as difficult as one would think. So it's an excellent place to start, is gather that information, call your insurance. Cold calling is calling, like, I get a lot of telephone anxiety. So I will usually have maybe like a friend do it, but calling around to see like, hey, I'm just curious, like at this location, do you have any gender affirming mental health providers? Or over here, I'm looking to, find an OBGYN who's affirming. Cold calling is an option. But since we have so much information at our fingertips, I always recommend looking online. And also, it's really important to recognize that it's okay to shop around for the right provider. If somebody doesn't jive with you, you do not owe them your time or space. And I'm sure that y'all advocate for that as well. We should never have low expectations. We should always exceed those expectations with finding the right doctor. Okay. So now that somebody has found a provider, what next? Patients should prepare for their doctor's appointments, making a list of questions and concerns ahead of time. though many patients are nervous, their questions may disrupt an amicable doctor-patient relationship. Most providers say this isn't the case. Nowadays, we don't exactly get a plethora of time with our providers, so it never hurts to show up with exactly what you want or need in that appointment. And we are human, and we're talking about genitals when it comes to transgender surgery, or like very personal parts of our bodies. And I think it's important to make sure that the conversation you're going to have with a provider, you feel comfortable with them and have done ample research. That's another thing that is very vital in in programs in general, but also in insurance advocacy. If somebody over here in California can perform, X, Y, and Z surgery, but you're going to be their first patient, maybe we should look into, patients should look into like their previous, that doctor's, like fellowships and whatnot. It's really, really good to be informed about the care that somebody's going to receive, so that nobody ends up being a guinea pig. Because again, we're forging the path in a lot of transgender surgeries, there's a lot of folks that are just starting, and it's a little bit scary to go through the world and not know, like, hey, my insurance only covers this one doctor. There are many ways around that. If the insurance only covers this doctor that's way out there in California, we have an opportunity to like do that single case agreement. And I know that might not be as pertinent here, but if that ever does come up with folks that are just moving into Utah or whatnot, we can definitely help organize those processes. So yeah, I did want to also just bring up that lastly, you say you saw your provider and later you got a bill in the mail and realized, wow, something feels wrong. I don't have $217 to my name for this appointment. It's okay to contact the billing office. And I highly stress that. It's also perfect to contact Jesse or myself. We're the advocates in the program to assist with billing errors, but also just because we have more capacity a little bit, billing folks, you might be on the telephone for an hour before you get help. And we want to be a smooth sailing answer to what would end up being somebody's cost. And a lot of these have to do with, we can do some digging and looking into, where our billing office could make errors, like we're all human. Even if you mistype one number, it could show up as some, being responsible for an amount. So it's something that we can look into. And I always stress to folks the importance of like, I can't keep an eyeball on everybody's billing. I want to make sure it's done right. But because like transgender benefits are so new, we run into a lot of billing issues, and that's almost to be expected, even though like we shouldn't lower our expectations. It's just something that as we are, working towards having this more broadly understood, insurances are very confused. And so we can really assist in being that advocate on the inside and looking into, the reason why. It could be as easy as mistyping a number, but it could also be like their gender marker or a name change. none of which is required to have surgery. This is just something that can come up on the back end after everything is said and done post-operatively. Let's see. So yeah, I just wanted to briefly just close with the importance of your health and wellness, health and healthcare rights, the way that we can work with insurance, and in finding a provider, doing research and asking questions. I think actually one of my slides disappeared, but I did want to bring up that for almost every single policy, you can easily call the insurance and ask to get a hold of their plan and say like, hey, can you give me specifically the transgender benefits or your policy handbook or Google online like Molina Healthcare transgender benefits. And it'll give you a list of the codes, or we don't necessarily have to focus on the codes, but on what hoops folks have to jump through in order to access care. Like I said, there are some Medicaid plans that require less hoop jumping. There are some that require more. This is something that, as more policies are getting turned around and there's more progress being made, hopefully it'll be more, accessible. But this is something that I always recommend calling and asking before any services are rendered, due largely to, the amount of hoop jumping. And I understand too that Medicaid policies can change from month to month. So oftentimes you can be on a plan that has more hoop jumping, and then next month go to a plan that has, less hoop jumping, because these hoops are all different ways that diminish the ways that we have access to care. If somebody is pretty sure what their gender identity is, then we shouldn't, as a whole, make it so that more folks have to have less access to care. The idea is more access to the care that they already know that they deserve. And then just down here, let's see. I'll provide this list to y'all, but Trans Equality is a really great website to use. I know that Sarah had mentioned Out to Enroll, and they're drastically, they're really outdated. So while the university can't say this is the policy that we jive with, I do highly recommend that go through, call the policies, ask for, specifically the transgender benefits, and go from there. And we're always happy to kind of answer any lingering questions when it comes to, what codes or what specifically should I be asking. Can always reach out to us, and we can help decipher some of that jargon as well. And then here are the grant options for a lot of folks who don't have access to have insurance pay for, anything. Gender Bands is local, and they have they work in congruency with the U of U in providing a myriad of gender affirming surgeries. So thanks so much. I wanted to allow some time towards the end, and I know I went a little bit over. So I will jump to chat. And is that okay if I go through?
Yeah, for sure. I was just gonna say, I think Jess answered our first one. But Tamara asks, is there a list of appropriate terms that we can use when helping this population? And then you mentioned specifically like coding terms. Like I've helped a couple of clients where we called ahead of time thinking that something would be covered, but because of how the service is coded, and maybe we didn't ask specifically about that code, you know, and then later having to help them through billing, I think that would be super helpful.
Totally. Yeah, I can definitely send over the list of codes. That's and again, like when we're talking nationally, trans programs use different codes, unfortunately, because coding was not meant for trans bodies or meant for cisgender bodies. And so, you know, we even code something like vaginoplasty or vaginal depth for intersex state, because there's not the equivalency for, you know, there's not a standard. And I'm hoping, you know, as the new WPATH comes out, or as we're able to advocate at a national level, then we'll be able to have these standard codes. But right now, the university uses different codes than, like, say, somebody in Colorado who is performing the exact same surgeries. There are some that are the same, but I can definitely send y'all over some like common codes too, if that would be helpful.
That would be awesome. And I think Tamara's clarifying, she also means just terms when she's working with the clients one-on-one. So some of the terms that you went over today, and just common terms that we would need to be aware of to be, you know, competent advocates for.
Totally. So just to be like respectful of their identities and whatnot, yeah, we can definitely send y'all over some resources in regards to how to talk to like gender variant folks. Yeah, this is definitely more on the aspect of like how to be a trans advocate, but the you know, like seeing somebody is another thing, seeing them for who they are. So we can definitely provide that.
I'm not seeing any other questions in the chat. If anyone wants to come off of mute, we have some time if you guys have any questions for Catherine and their team.
Can I give your email to my clients if they need help with billing and stuff?
Yeah, absolutely. 100%.
Thank you.
Sounds like that might be everything. Anybody else? Okay. Well, thank you so much, Catherine. This was a really great presentation. I think this is really helpful for us to hear just when we're, you know, we've helped someone enroll or folks that may not qualify for coverage, and how we can still help them seek the services that they need.
Totally. Yeah, and feel free to reach out to our team. Happy to answer any lingering questions. I'll send over some resources for you know, talking with trans folks. And then yeah, I'll definitely send over the PowerPoint, because there's some really great the transequality.org is a really great place to start with insurance coverage, the right questions to ask, and understanding what is covered in general. So these are some really great resources. I'll definitely be sending over the PowerPoint.
Awesome. Thank you. And I think that was the last question in the chat, is if we were going to be able to see that PowerPoint. So that's awesome.
All right, beautiful. Thanks, y'all.
Thank you so much. Thank
Have a
you.
good day, everyone.
Thank you.
Thank
Thank
you.
you.